The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our socially distant technical producer, J.D. DeAngelis. We continue our shows from the administrative offices and wish our friends at WHBC and our listening audience continued good health. Our guest today is Vicki Iono, RN Health Commissioner with the City of New Philadelphia. Vicki, welcome to the show. Thanks for joining us. We're looking forward to talking to you today.
Well, thank you for having me, Paul and Brad.
For the past 3 months, coronavirus, or COVID-19, has dominated the news and our lives. We could have never anticipated the changes we would experience, and we all find ourselves wondering if things will ever go back to normal. This morning, we're going to talk with Vicki Iono, Health Commissioner, about COVID-19, how we got here, the status today, and a picture of the future. And Vicki will also explain and discuss contact tracing. We'd like to remind our listeners today that the program is going to be available on our podcast, which can be downloaded from the App Store on your mobile phone. You can also look for Health Matters with the Medicine Center Pharmacy and listen to any programs anytime, anywhere. The video for this program will be posted on our YouTube feed later on Monday, so watch out for that. If you have any questions you'd like addressed, post them up on our Facebook feed today, and we'll address them during the program.
So, Vicki, welcome to the show again. Tell us a little bit about yourself, your background, your role at New Philadelphia City Health Department, and your personal life as well.
Well, good morning, everyone. I'm Vicki Iono. I'm a registered nurse. I attended Kent State University, got my nursing degree. I've been in public health about 19 years, and about 9 of those I've been the health commissioner here at the City of New Philadelphia's health department. I'm married to my husband, Mario, and he and I have been married about 39 years, and we have 4 adult children, and I always say 3 adorable grandchildren. So that's the love of our life right now. So
you mentioned how long have you been in public health?
Public health, 19 years.
Okay. Where is the New Philadelphia Health Department, and would you like to share contact information?
Sure. The City of New Philadelphia has their own health department, which is located downtown New Philadelphia in the City Hall, which is at 150 East High Avenue in New Philadelphia, of course. We are located in the lower level of the City Hall, right on high.
So let's start from the beginning. What is COVID-19 and how did it first start?
Okay, so I'll do my best. COVID-19 was originally named the coronavirus, and then the World Health Organization changed the name to COVID-19 a few weeks into the spread. It's a virus, of course. It's a brand new, what we call a novel virus, which has never been seen in this world, and that's making it so dangerous for everyone. We are not sure where it started for sure. It's thought to have started back in December in a wet market in Wuhan, China, but there's different theories on how it started right now.
Well, I know we heard first it was from bats, and then we heard something else, and then something else, because they do consume some unusual foods in China, things that we would never consider eating, and I suppose that's because there's so many people.
Right, and that's a cultural thing as well. I did a few presentations early into this virus outbreak and gave some pictures of some of the unusual animals that are eaten and sold in those wet markets. And they call them wet markets because it's very wet. A lot of things are on ice and melting and running across the walkways. So, it is possible and has happened in the past where a virus that is known only be in animals has jumped to humans, and then it spreads from there.
How did it get to the United States?
Well, it's known to be because we're such a mobile society. It came to the United States through travel, and it's so easily spread. So that's how it got here. And we first saw it in the United States in confirmed cases over in Washington State.
Okay.
So, can you remind everyone of the symptoms of COVID-19, especially what symptoms would make them call their physician or health department?
Okay, so originally what we tried to instill in everyone is to monitor themselves for a fever greater than 100.4, also a cough, because this is a virus that is notorious for landing in the lungs, in the respiratory, and starts to spread. When we do the chest X-rays, we see it in both lungs, usually scattered throughout, and that's what we consider like a viral pneumonia. And then we get the patients who are short of breath because of that virus taking over their lung space. But other symptoms we're seeing are some are flu-like and some are not. We see gastrointestinal issues. We see body aches and chills, which is, usually with a fever and also flu-like. We start to see now people that have unusual symptoms like loss of taste and smell. We have people that report that all of a sudden they can't taste or smell anything. So that's different than the influenza. And we have seen a lot of conjunctivitis, so eye infections. And those are now another sign or symptom that this person could be COVID-related or COVID-infected.
Do you feel that we had a flu season that was in line with years past, or with all of the social distancing, do you think that had an impact on minimizing some of our contagious diseases so far this year?
It always helps whenever people stay at home, I guess, to stop spreading everything. I think when we first started seeing coronavirus in early March here in Ohio, we had already were at the tail end of our influenza. We still had some cases that we got reports on because laboratories by law are required to report any infectious disease to the health department in which the person resides. So we always get the reports when anyone's hospitalized, only hospitalized for flu, not just that they went and bought some medication and stayed at home. But when they're hospitalized, we receive that report and we enter that into our state system. But I think it does help whenever we're staying apart and not sharing possible, infections. But we were sort of at the tail end of influenza whenever this started coming in.
Okay. Why do you think COVID affects some people so differently?
I wish I knew that. So we hope to find that out someday in our future as scientists do more and more studies of this virus. But here at the health department, we see the whole gamut. We have people who test positive and absolutely report no symptoms, do not feel sick. Matter of fact, we have several work sites that are going in and mass testing all their staff, and they're at work. They have been screened as they came into work, like they checked their temperatures, checked to see if they had any complaints of these COVID-like symptoms, and did not have any, and went on to their job posts. And the laboratories came in and did mass testing there and found several. Matter of fact, I received 3 yesterday from a work site that were at work and did not have symptoms. We call it asymptomatic. Mm-hmm. And they were positive. To me, that's the most dangerous thing. Now, I know the World Health Organization came out this week or a few days ago and made a statement that the risk of someone asymptomatic is very low to spread, but it's still possible. So I think, and they retracted that a little bit the next day. But everything about COVID is very fluid. It comes and goes and changes constantly.
How many cases does Tuscarawas County have?
I just pulled it this morning. As of yesterday, about 2:00, Tuscarawas County as a whole, and that includes New Philadelphia numbers, we have 403 positive cases that we are aware of. Out of that, 138 of them reside in the city of New Philadelphia. We've had 7 deaths, 3 of them out of the city that resided here in the city, and 4 outside the city in Tuscarawas County.
Mostly elderly people. Or?
The infectious rate, the average age is 38. Excuse me, for infection, but the death rate, in my case, we had a 43-year-old, a 65-year-old, and a 57-year-old. So not the elderly, but nationwide, I believe that the highest age group is the over 80 long-term care.
How about the young people, like children, say, under 15? Do we have many of those cases?
We've seen it. We've had, in my city, we've had an infected baby, 2 weeks old, infected 5-month-old, an infected 6-month-old. So they do get infected. They seemed to fare pretty well. It's not as deadly for children. But unfortunately, they become sort of a reservoir, and they can cough or infect the adults in their world, their parents, their grandparents. It could be deadly for someone else. You had asked me earlier about why do we see it severe in some and not in others. I don't know. I have to think it's our genetic makeup on how our body responds to inflammation. And whether it overworks and becomes overwhelming in some people, because we have these folks with no symptoms, and then we have people who can't breathe. So and we have people on ventilators right now as we speak here that reside in the city. They're in hospitals on ventilators because they had to have, respiratory support. So
okay,
it's something we hope to know.
First break, you're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Vicki Iono, RN, New Philadelphia Health Commissioner.
Vicki, when did we see our first COVID cases in Ohio?
Okay, so we saw our first cases were 3 cases that were diagnosed in Cuyahoga County, and that was March 9th. And then we saw our first case in Tuscarawas County on March 14th. And then the first case we saw here in New Philly City of one of our residents was March 24th.
Fast spread, boy.
Yeah, that's less than 3 months, and it feels like 3 years since this all hit.
It does, and it's interesting depending on when this really began in China, between even if it was October, November, December to New Philly, Ohio in March, that's crazy. I mean, that fast around the world, that's wild.
It's absolutely mind-boggling how fast it came to us.
So, Vicki, tell us about Tuscarawas County and how that's impacted. We talked off camera, I think, about the number of deaths. And I guess the question also should include, how has it affected the businesses and the people and all that sort of thing in New Philadelphia?
Sure. It's like everywhere else. We had the stay-home orders, and it really impacted a lot of our businesses, especially the small businesses that struggle already, to make a decision to try, say, some of our restaurants to continue just to do carry out. And could that be, could they actually break even to do that financially? Others chose to close, and some are struggling to open back up as we're allowed to now to start opening up with all the new guidance in place and all the new safeguards to continue to slow the spread of this coronavirus. So it's been devastating for some, for sure, and all the folks that lost their jobs even temporarily. The governor did add an incentive of like $600 extra a week to help people that were laid off to keep above water. So I think that may have helped for the folks who were able to collect that. But for the restaurant owners and some of the business owners, it's been a real struggle.
How many closures do you know? Is that in your ballpark?
I'm not sure of the number. I sit in on a committee called Restart Tusk, by our community business associations, and they're working hard to help subsidize some startup money, and I'm taking applications for some small grants to help people get back open. I know it's in the hundreds. I'm just sort of familiar with the city of New Philadelphia. There's about 100 or so businesses that were really impacted negatively.
I've been in a couple of restaurants since they reopened, and one of the restaurants told me because of the restrictions, they've lost 80 seats in their restaurant, and the other one told me they lost 60. And they're thinking, boy, that's a lot of people.
Yeah.
And how do you balance that with staffing and inventory, food, that sort of thing? So that's a tough one.
Yeah, it is tough. And some of ours have gotten really good at thinking outside the box. And, of course, it depends on what space they have available to them. But some of them expanded out onto the patios so they could seat more and keep those numbers up somewhat. Others were able to put in some good safeguards like plexiglass dividers and or curtain-type things to put in some barriers between, and to get that 6-foot distance, it's a real challenge.
I've noticed one of the places used shower curtains, and I thought that's kind of novel.
That's just thinking outside the box. They're doing what they can to try to survive as a business and also still meet the guidelines as best they can, And my office works with that. We license all this restaurant and retail food establishments in the city. And we do our best to try to assist them as best we can to show them the guidelines and make sure they understand them, but also to give them some good ideas on how they can make that work out for them and be open.
We have boxed in all of our checkout counters in our stores and with pretty sophisticated systems, and they seem to be working okay. Our stores are open, so.
Some of the things that people have done, like your checkout counters, getting the plexiglass in place, and I almost everywhere I go now, I've seen that. That's actually a wonderful thing. I hope stays forever, because that would help us a lot from not spreading influenza and the common cold. If we could help block some droplets. Here in our city hall, we installed some new safety glass at our window, along with our other public counters down here with income tax and water department, and just put in a little slot to slide in and out the paperwork, and that will help us put the droplet block there. So hopefully.
Do you have drive-through service at the city hall of any sort?
No, we don't. But while we were closed, our city hall was closed to the public for about almost 2 months because we're trying to abide by some of the stay-home stuff. But we continued to operate. We were in here working every day. We would come up to the door and meet people that needed death certificates, birth certificates. We had a few appointments for, our good patrols and things like that. So we would work that out. We did what we can to serve people and do it safely, of course.
Well, that's pretty interesting. I guess I thought most city governments were sort of closed except for a few people.
Mm-hmm. We continue to offer a few services that we felt essential and that we could not put off, and we worked it out where we did it safely. We do require facial coverings to come into the city hall now. We are open full-time.
All right, folks, time for the news, bottom of the hour. You listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
More news coming up at 10 o'clock. I'm Pam Cook.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
Wendy here from Studio Arts and Glass. We're open and ready for the Garden Art Show, June 12th and 13th. That's Friday and Saturday from 9 until 8 p.m. Call to reserve your space to make a succulent wreath or a living wreath for your door. The event is inside and out so we can socially space, featuring local artists, pottery, jewelry, and of course, stained glass. Studio Arts and Glass on 77 and Apple Grove in North Canton.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Listening to Health Matters today with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing COVID-19 and contact tracing. We've got a lot more to cover this morning, so let's get back to the show. So, Vicki, how do you think the population is responding to this? Well, you never had anything like this before, at least in my time.
No, and neither in my time either. I've been, like I said, in public health for 19 years. I've never, ever experienced anything like this. And no one has in 100 years, so it's certainly knocked us back on our heels for sure.
Do you think we overreacted?
No, I don't think we're overreacting. From where I sit on my perch here in public health, I'm dealing with a lot of really sick people. And, and people will say, so what, we have flu and it kills people too. Well, this is 3 months in the United States, we've lost over 100,000 lives. 115,000 lives. That's unprecedented, So I think it's very serious, and I think people need to take it as so.
Isn't a typical flu virus, flu epidemic, whatever? Don't we normally lose about 100,000 people?
No, I think this past season, the numbers I saw were about 18,000 Americans died from influenza.
Okay. I think I've been through about 6 flu epidemics. Like in my lifetime, I can remember the Hong Kong flu years and years ago in the 60s.
Mm-hmm. And I remember H1N1 back in 2009. I was in the height of that. That was a scary event, and that's included in our seasonal flu now. That's something we boost every year. We had a lot of loss of life back then too, but it was hitting the young and healthy. The 20 to 40-year-olds were the most.
Okay.
Affected.
We are about to see our flu vaccine, aren't we, for the flu season?
I get mine about late August.
Okay.
That's about when I see it arrive here.
It'll be interesting to see how that's formulated this year.
Yeah. And again, what we talked about earlier is just people's response. I'm hoping that people will come out and get their vaccine for influenza to try to eliminate one of the deadly viruses that we could see.
Sure, a new flu virus mingling with the current 19 virus.
Double trouble.
So I know. Oh my gosh. Do we have any cases of people with both of them? Is it possible to figure that out?
Yeah, there's always a case. There's always a chance to have what they call a co-infection. So we actually did see a few people that was positive influenza and positive COVID at the beginning of this thing in March. So it is very, very possible. And I think a person can't fare very well if you have both at the same time.
Well, that's something. They survive? These people?
These people did. These few that we had that were co-infected did survive. We were happy about that.
Good deal.
What's the current trend with COVID cases in Tuscarawas County? Is it on the up or on the down?
Okay, so we hit our spike here locally, both the county and I, about early May through the mid-May, so about 2 weeks, we were overwhelmed with cases. We, to be honest, I haven't had a true day off in 3 months, and we were working night and day, and weekends, nights. I was being called 4 a.m., 3 a.m. by the hospitals with positive cases. It's like I said, from where I'm sitting on this perch, it's very serious and it's very deadly. So we did see that spike the first couple weeks of May. We've seen since a downtrend, but it's staying steady. We're still seeing, on average, 5 to 10 cases a day countywide, which is not exactly zero.
Yeah.
Was the hospital ever packed with people sick from this?
Were they full as far as capacity?
Yeah, exactly.
Yeah, the hospital was strained, and it was that same time that we were seeing it. We were seeing the strain at the hospital as far as in the ICU and the ventilators. That was mid-May, first 2 weeks of May. They were feeling that strain. They actually set up an outside tent in the beginning to triage and test people for COVID to try to eliminate the contamination inside the hospital. And of course, all the restrictions were happening too, where they shut the doors pretty much to anybody just from the public.
Wow.
All right, well, let's talk about contact tracing. Can you tell us what that is, and give our listeners some background on? I know everyone's fear is how invasive it could be to their privacy.
Sure. Okay, so what I always start out by saying, folks, we're in a global pandemic. Things are a little bit different, and you need to have more of an open mind of why we're doing what we're doing. From the public health standpoint, we know that to get ahead of the spread and to slow it, we can't stop it until we get a good, valid vaccine or good treatments. But to slow it and have less loss of life, we need to make folks aware that they were in close contact with someone who was positive. So the way it works is we get a confirmed positive result from our labs, from our laboratories, and we then have to do what they call, state has trained us to do contact tracing. Contact tracing then involves us reaching out to the patient if it's possible. Sometimes the patients are on ventilators and they can't talk with us and tell us were they near. So what we have to do is go then to a close relative of theirs, someone who would be involved. If that doesn't work, we sometimes reach out to their employer. And, we don't breach confidentiality, but we do have to find out what shifts they worked and who possibly worked within the close proximity of them, within 6 feet for more than 10 minutes is what we really concern about. And then it could be family members, it could be friends, it could be work contacts. And we put those folks in quarantine. And quarantine means that you are asked to monitor your symptoms for COVID for the next 14 days from the last time you were in contact with a positive case. We don't disclose who that positive case is to the person we notify in an effort to try to hold that confidentiality, but sometimes they know, sometimes they don't know, depends. We don't disclose. But we do ask them to monitor symptoms. And depending on where they work, a quarantine folk could possibly go on to work. If they work in an essential business being like healthcare, and healthcare is struggling to have enough staffing. If that person is asymptomatic, has no symptoms of COVID, and wears their mask, their PPE, we call it, then they are allowed to work as long as they're monitored for symptoms at work and also at home. Other things that are essential are like the food chain. If they work in a food chain business, that is an essential business. there's things that can be done. Now, some work sites have policies that they want people in quarantine not to come in, and others need them to come in. So it depends on the work site.
Okay, so how about this? Let's say that I have a friend who tested positive, and how are you at the health department going to call me? And we live in a world of spam email and spam phone calls and telemarketers and all this crazy stuff, and not to take anything away from someone trying to make a living, but how can we trust the method with which we're contacted and know it's sincere and legitimate?
Yeah, well, we try our best to let them know if they won't answer their phone. We try to leave a message that the health department is calling and we would like to talk to you. Please call us back. And that's all we release at that message. Most of the time, if they're involved with someone who has been tested positive, they're very much aware that they may be called. And some people know and some people don't. We do our best to reach out. Now, we have then, if we can't reach them by phone, we do go to their home. And that is our obligation to do that because we are trying to stop the spread. If we can make people aware that they have been in close contact, then they can monitor symptoms. They can also just go, if they have to work, straight to work, wear their personal protective equipment, straight home, try to not interact with family members at home until they get past their quarantine days, and try to not reinfect other people in case they are developing symptoms then.
Okay, so we know how long quarantine is. What about isolation?
Okay, isolation is when you're the person who has the infection, and the CDC originally had put out guidance that a person who is infected has to be at home for 14 days. They are not permitted to go to work, even with protective equipment. That has been reduced to a 10-day, and 10 days is flexible because some people aren't feeling better by 10 days. But the guidance is that you have to be at least isolated for at least 10 days, and isolation means to try to sleep a separate room, use a separate bathroom if possible, try to isolate yourself from your own family members at home if possible. Some people can't, they don't have the space. But if they do and can, they should at least stay 6 feet or further back from the family member at home. And then if they're feeling better after 10 days, we will give them a release letter to go back to work. But they have to have had 3 days or 72 hours without any fever, without fever reducers, and they have to have their symptoms resolving, which means they are breathing better, they're coughing less, and the symptoms have started to resolve, and then they'll be permitted out of isolation. Some of our folks end up in the hospital after 10 days. They're even worse than they were in the beginning. They seem to be doing okay at home for a while, and then all of a sudden they just get in respiratory trouble. So it just depends on the individual.
So what is the typical length if you're infected? Is it all over the map or length of time of COVID, or you get it, or where are we at here?
What was your question about it, Paul?
Well, if I were to get COVID, what would be the typical length of time to take me to shake it?
See, again, it's individual. Some people only had a low-grade fever for a couple of days and then are actually feeling okay, and they're staying at home like, when can I go back to work? And then there has other people, like I just spoke about, that were doing okay at home. They didn't feel good. It's like a really bad flu, but they're at home. They could still breathe okay. And then all of a sudden it got worse on them, and they ended up hospitalized. So, I mean, the rule of thumb for quarantine is 14 days. And as long as you don't develop symptoms, you can go back to life and work as normal. Some people, 10 days for isolation after infection is enough, and others it is not. And I have one right now that's about 4 weeks in, and he's just now starting to feel better. And he was in the hospital twice. He was hospitalized twice.
Wow.
Okay, gang, time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us today, and we're on our last segment of the show. So how about facial coverings? Should we be wearing them?
Okay, so I know that that's a hot topic, and it upsets people, and it's not comfortable. I don't like it. I wear them. We do know that COVID is spread through respiratory droplets. Hence the reason we're using all the plexiglass at checkout counters and things like that to try to block droplets. If for someone who's asymptomatic, or now what we call pre-symptomatic, meaning they will develop symptoms, they just don't know it yet they're infected. We know that those droplets, even the fine ones out there coming out on their breath, is enough to actually infect someone. So the facial coverings come with trying to block your own droplets, just in case you are pre-symptomatic or asymptomatic, and you're standing closer than 6 feet with someone. It doesn't filter a fabric mask that we made at home, doesn't filter the droplets coming at you. It's more to block your own droplets from infecting someone else in case you are infected and aren't even aware of it. And that we think that will slow the spread if everyone can wear a facial covering just to keep their droplets to themselves. But it is not easy to wear, and it gets hot, and there's some legitimate reasons people cannot, but most of us can, and we should while we're in this global pandemic.
How long do you think we're going to have to worry about COVID infections?
Oh, Brad, I wish I knew that.
Come on.
I could probably make some money or buy some stocks or something. I think what we're looking at and listening to all the experts and in all the public health conferences and emergency operating center calls that I'm in on, and the state health department, I'm in on several calls a week with them. So what we think is we hope to slow the spread and slow the amount of people who will die from this infection, because we don't know how each one of us may respond, how difficult it may be for us. But until we get a good treatment going on, or until we get a good vaccine. And I know you know, and the public may not know, that what I've read, as soon as any vaccine's ever been developed, has been 4 years. It took 4 years to develop. So if we have one by this time next year, that'll be like lightning speed.
I think it's maybe not the right word to use, but I think one of the interesting things about this experience has been how there has been a global community come together with respect to researchers and science and trying to crunch data and learn all we can. It'll be hopefully rewarding in months and years to come to look back and see what we've learned, and hopefully we can make a better solution going forward for all infections.
Right. And as you know, we've seen infections that hit the United States hard or hit Australia hard, but we've never seen it hit the whole entire globe. So this is so unbelievably amazing to be that and how fast it spread. It's just amazing. But we're hoping that a vaccine will come sooner than later. I do know that there's already trials going on. People are being injected already by certain vaccines, and there's already production being done just in case they work, because then it takes months and months to produce those in the labs.
Well, we've got about 2 minutes left. Vicki, do you want to leave some parting comments and words of good hope for all of us out there in the listening area?
Yeah, the good hope is I think that maybe the stay-home orders and stay-safe orders and all the different orders that we've had has been real inconvenient. I'm hoping that in some families and some people's lives it had made us hit the reset button to get to know our families again, to slow down a little bit, to try to go back to playing some board games at home and not depend so much on the world to entertain us. I do know yesterday the governor has announced that as of yesterday, anyone who wants a test now can be tested. We've been restricted up to this point because we were concerned that there wasn't, and at first there was shortages in reagent and shortage of swabs, and now we're in good shape with testing capability. So anybody that wants it can get it, and on that coronavirus.ohio.gov site, people can look to see who's testing in each county and go there and get tested, and it should be at no cost to them.
Interesting. Well, and we as pharmacies, our stores are open. We have plenty of masks, hand sanitizer, all those ancillary things that you do need to keep safe. So I think we're out of time, aren't we, Brad? Pretty much.
Yeah, we are. Thank you, Vicki, so much for taking time out of your busy day.
Oh, I appreciate you guys inviting me to talk. It has been our life for a while, so I'm glad to talk to you and share with you what I know.
Vicki Iono, RN Health Commissioner of the City of New Philadelphia. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. And thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, J.D. D'Angelis, our technical producer. As always, we thank our listeners for joining us today on Health Matters.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's MEDSHOPRX.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.
Breaking and trending.
As part of bringing Akron and Canton closer together, the Ohio House has passed legislation permitting creation of an airport development district around CAK, operating much like downtown Canton's Special Improvement District.
So now that we're calling people back, it's important for workers to know and employers to know that if they don't go back to work, it's a strong term that could be declared fraudulent.
Find more right now on WHBC.com.
Looking for future leaders we can trust and believe in? Look no further than the high school student athletes right here in Ohio. High school sports teach young people how to be effective leaders. It begins by making their grades and being on time for practice. It includes learning to listen, following directions, accepting responsibility, being a good role model. And it's about respect for officials, opponents, the rules, and each other. The result? It transcends sports.
This is Jerry Snodgrass, Executive Director of the Ohio High School Athletic Association, where sports are an extension of the classroom. Thank you for your support of high school sports in Ohio.
This message presented by the Ohio High School Athletic Association and the Ohio Interscholastic Athletic Administrators Association.
Provided by News Talk 1480 WHBC.